When patients have to undergo spine surgery, one of the principal things they worry about is, will they be able to get back to work? Will they be able to resume their career, their livelihood, get back to the job to be able to earn money to support their families? That's a great question. We did a long-term research study that looked at the ability for patients who've had spine surgery to return to work. And what we did is, on an average of 5 years after spine surgery, we contacted these patients and we asked them, are you working? And if so, what kind of job are you doing? We looked at 255 patients, age 19 through 60, all working prior to their surgery, all of them undergoing different types of spine surgeries. And what we found is, an average of 5 years later, 95% of patients who had had a lumbar discectomy were still working 5 years later. What we also found, which surprised me, is that 90% of patients who had had a spinal fusion were still working 5 years after surgery. And even patients with major surgery for spinal deformity, those patients, 80% of them were still working 5 years later. So what does that tell us? That tells us that spine surgery, when done correctly on the right patient for the right reason, is very effective, and it has long-term benefits, even out through 5 years, with 90% of these patients still working 5 years later. Interesting data from our research here at Sonoran Spine Center.